Hello everyone. Welcome to Dentospedia, a learning platform designed to simplify dentistry for the students preparing for various global dental board exams. And today I am going to give you a short lecture from endodontic module, that is the clinical diagnostic method. So let us understand this chapter. In this chapter, in the clinical diagnostic method, it forms the backbone of the endodontics. Before we decide the treatment for the periapical diseases and the pulp, we should must understand what happening inside this tissue, that is the pulp and the periradicular tissue. And this chapter teaches us how to systematically evaluate the patient with using clinical case histories, clinical tests, and also radiograph finding. So let us begin with the chapter. First is the diagnosis. Diagnosis is the systemic process of collecting and interpreting the clinical information to identify the cause, nature, and the extent of the oral diseases. So it is a systemic collection of the clinical information so as to an appropriate treatment plan may be formulated. So diagnosis is important for the appropriate treatment plan. In endodontics, it specifically means determining the pulp and the periradicular status of the tooth. While the diagnosis is also defined as an art of distinguishing one diseases from the another. So it is very important to come to a proper diagnosis to formulate a proper treatment plan. An accurate diagnosis, it prevents an unnecessary treatment and improves the prognosis of the case, and also it corrects the prioritization of the emergency care. So it is important to come to an accurate diagnosis to prevent unnecessary failures and have a good prognosis. Coming to diagnostic workflow. So diagnostic workflow, it includes case history, which is the most important, which include medical, dental, and the presenting complaint, that is the chief complaint of the patient. Then coming to clinical examination, which combines all these complaints to the clinical examination. Then after clinical examination, some clinical tests are done, and then based on these clinical tests, taking the particular and interpreting the radiograph or the other images which required. Then coming to a formulation of the diagnosis. Then finally, of the management of the option by discussing with the patient. So here we discuss the patient with the final management, and then with the informed consent proceeding with the proper treatment plan. So we can see how the diagnostic workflow comes from starting the case history, then to diagnose the patient, and then coming to a proper treatment plan. Then coming to history and the record. Definition. Case history is defined as data concerning an individual and his or her family and environment, including the individual medical history that may be useful in analyzing and diagnosing his or her case for instructional purposes. So here in the case history, it is very important to take a thorough history of the patient, also the case history for the family, and also include medical or the past dental history. Now, recording the chief complaint of the patient in patient's own words. It is very important as the chief complaint is the main base of the case history. So it is very important to note a proper chief complaint in patient's own word, and then ask about various factors like onset, duration, frequency, intensity, character, provoking factors like aggravating factors or relieving factors, previous episodes of these complaint, previous dental treatments, trauma, systemic illness, which may include any medical history or illness or medication patient taking, and record responses precisely because these details then direct the diagnostic testing sequence, as these chief complaints are the main base of the case history, so it may impact the diagnosis. So it is very important to take the thorough chief complaint, including all the factors. So we can see a sample of these, a case history record, including the patient name, address, age, gender, occupation. The patient has a good health. The patient is been suffering from any medical problem. The patient has been taking any medication. The patient is allergic to any medication or local anesthesia, the patient is still taking any medication. If taking the name, so why? We have to take a thorough history of medical dental reports. And also signature of the patient is very important with the date. Coming to symptoms, now they are defined as a phenomena or the signs of the departure from the normal state, and they are indicated of the illness. So these symptoms are the phenomena which indicates of illness, and these symptoms are classified as follows. First is the subjective symptoms. These are the symptoms those are experienced and reported to the clinician by the patient. So these are the symptoms which are complained by the patient. Patient is complaining to the clinician, which is also known as, these subjective symptoms are also known as signs. So we can say signs or subjective symptoms. When coming to objective symptoms, these are the symptoms which are ascertained by the clinician. So these are ascertained by clinician through various tests, and then the clinician gives this report to the patient. So these are the symptoms which are reported by the clinician to the patient. But a proper correct diagnosis needs both the subjective and also the objective symptom. So here the symptoms are very important, which lead to a proper diagnosis, and hence from the proper diagnosis we can come to a proper treatment plan. Thank you so much for listening this short lecture. To learn the entire chapter in detail with flowchart, diagrams and case-based explanation and exam MCQs, download the Dentospedia app today and start learning endodontics with clarity and confidentiality. Thank you.